will perform hand hygiene. Hi, my name is Ryan. I'm going to be your nurse for this evening. Just going to check your wristband. Can you tell me your name and date of birth? Right. After I confirm that the patient is the correct patient, inform them. I'm here to do postpartum assessment. What that entails, we're going to start with vitals, but then we're going to move down. I'm going to check your breast, your uterus, your pads, and like work our way down. There might be some exposure. If there's any guests or visitors in the room, I would explain this to her just in case she wants them to leave. Then once she confirms that she's okay with it, alright. And I just want to check, do you have any allergies, any food, medication allergies? No? And then are you in any pain? If the patient was in pain, I will use the old cards to chart and identify. Then if she says no, pull the blinds to provide some privacy. Grab some gloves. Then just bring the bed up to a working height. And for now, we're just going to start with normal vitals. Do you have any preference on which arm I take blood pressure on? Nope. Patient's blood pressure is 120/80, which is within normal range. And next we're going to take temperature. Again, you just open your mouth, raise your tongue. Patient's temperature is 98.6. Connect the pulse off. Patient's O2 sat is 96, which is also within normal range. And for this next part, I'm going to auscultate for your heart sound and then your lung sounds both anteriorly and posteriorly. So we're going to start with your heart sounds, which I'm going to listen at the PMI, which is made curricularly on the fifth external border on the left side. And I'm going to listen for a full minute. Patient's heart rate is 80, which is normal. And then I'm going to listen to breath sounds in the zigzag step down pattern from top of the lobe. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Then I'm going to assist the patient to upright sitting position so I can listen posteriorly. And listen in the same zigzag pattern. Inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Breath sounds are absent of any wheezing, cackles, or any other agitation breath sounds. So now, moving on to this portion of the postpartum assessment, I'm going to have to assess your breath. Have you had any like tenderness, soreness, firmness? If the patient does state this, and also are you breastfeeding? I'm going to ask for the patient's permission first. Is it okay if I palpate and assess? If they give me permission, I'll move the gown down enough to be able to assess both first visually, bilaterally, and then palpate. And when I'm assessing for to make sure that they're soft and full, and then I will assess the nipples. One nipple it's apparent that one nipple has cracking, appears to be bruising, and then the other nipple is fine. I would chart this as well and ask her, have you had any issues with the baby latching or failure to latch? And then I'll probably put in a consult for after this to educate about proper feeding. Then we're gonna move down. I'm gonna assess your fundus. If that's okay with you, I'm gonna move the gown down. I'll just be palpating your stomach region. She gives me permission. I'll move the gown out just enough to expose the area that I'm working on. And I would use one hand above her pubis to apply pressure. And the patient had a vaginal delivery 2 days ago. So you too, go 2 centimeters below the umbilicus, and then palpate the top of the fundus. The fundus is firm in midline. And then I would assess bladder. And when's the last time you urinated? Was there any difficulty with urination, any burning sensation, any pain? She says no. For reference, for the first 24 hours after delivery, if this patient fell in that range, I would track eyes and nose, but since she doesn't have any Foley catheter for me to assess, I'll move on to assess bowels. For this, I'll put the head of the patient's bed down. Are you okay if I lower the head of your bed? Then I will also take for bowel sounds, starting in the right lower quadrant, right upper quadrant, left upper quadrant, and left lower quadrant. Bowel sounds are present and appear to be within normal intervals. If the bowel sounds weren't present, I would assess each quadrant for 5 minutes each. Now, also ask the patient, have you had any issues? When was your last bowel movement? Once the patient says that, was there any difficulty with the bowel movement, any pain, discomfort, bleeding? If she says no, that it was normal, I would then inform her that we're gonna move down to assess lochia. For that, I will first ask her, how many pads have you gone through today? When she states her number, how would you describe them as far as quality of the color on them and quantity? She would state that information. And did you notice any blood clots? And if she says no blood clots, that's a good thing. Then I'll ask you, is it okay if I assess this one? If she says yes, I'll move down to assess the pad. Since she did deliver vaginally 2 days ago, I'm expecting rubra color, either scant or normal amount, but heavy flow will be wouldn't be a good sign, or if there was heavy clotting, which none appears to be present. Cover the patient up. And then I'll perform her. For the next part, I'm gonna check your perineum and your episiotomy. Is it okay if I turn you to your side with her permission? And are you able to turn? If she's able to turn, I will just assist her with turning. I'll help separate her glutes to check her perineum to look for any ripping, episiotomy, also assessing for hemorrhoid. If any of this was present, I would use Rita to document this information, which none appear to be present. And I'll help position her back supine. Additionally, because it was a vaginal delivery and she didn't have a C-section, I wouldn't document using Rita on her abdominal region as well. Then for the last, we're moving down to the second to last one is Coleman's. For that, I'm gonna have to expose her legs. I will cover her back up. First, I will visibly assess for any edema or bruising, swelling, redness. If none are present and she wasn't at high risk for superficial or deep thrombosis, I would then do the assessment. I would hold her upper thigh and dorsiflex her foot. While doing this, I would assess for any redness, edema, and pain. Ask her if she experienced any pain. No. Then I would assess the other side. No pain with this as well. Also no redness, no tenderness. Would cover the patient back up and take this opportunity to do an emotional evaluation. So you have a lot of family in the room. Congratulations again on the baby. I will ask the patient about the baby name, how she's feeling, if this is her first pregnancy. And then once the emotional evaluation is done, I'll ask the patient if they would like to be placed back into the Fowler's. Do you like the head of your bed back up? If she says yes.
Well, I took care of this one. They tore this one. There should be one that's stronger in there, but you can use.
At this time, I'll also ask the patient.
Sometimes if there's not one in the
anything to drink.
bin
She
for
says
that
no.
one, you could take it
My
out
patient
of
doesn't have any IV
the
connected
feed.
at this time, no Foley catheter.
Use
If
that
she
one.
did, I would assess that equipment as well. If she says everything's good, I'll put the call light next to her and then lower the bed to the lowest setting for safety. Put the rail back up. Assess the surrounding area for any equipment that may have gotten moved during the assessment. Congratulate her on the baby again. Congratulations. And if you need anything, don't be afraid to hit the call light. We're all here for you.